How's that? How's that now? I was going to say I couldn't see the bar flickering on my microphone, so I was thinking, oh, am I plugged in? Just let me know if that's okay now. Yep, cool, good. Right then, let's get going. Yeah, welcome to Learn Anatomy Online. Monday morning again. It's bank holiday. Hopefully you all had a good New Year. And yeah, here we go again. So we've covered quite a lot already around the knee, and last session hopefully on the muscles today, and then we'll go into the nerve and blood supply next week. This week sets that up quite nicely because there's a few structures where the blood supply run through that you'll be introduced to today. And they're useful to know for examination purposes if you do that kind of thing. So one of the reasons why people's feet go numb, it could be a blood supply issue or it could be a nerve supply issue. And the nerve supply issue could be anywhere from the spine all the way down the pathway of the nerve. So it depends on the kind of symptoms that someone is getting. So knowing where the nerve goes through and those pathways will help you determine what kind of testing to do. So if you know neurological testing, you know how to do testing for the just feeling a pulse basically, then you need to know the pathway so that you can get the correct location for those anatomical structures. So yeah, hopefully this will make sense. So we've done the lower leg, or we've done the leg, which is from the knee down to the foot, and we saw how behind the knee you've got the popliteal artery, and then that then divides and then goes down into various areas in the foot. So that was obviously done a few weeks ago. What we're going to do after today's session, and like I said, this one will set next week's up quite nicely, is we'll see how the popliteal artery, where that comes from. And then as we go up into the hip, where it joins into the iliac arteries in the hip. So yeah, you'll be able to track back and see the flow of everything down, and that's really useful, especially with certain populations, because we often kind of not misdiagnose things, but we kind of assume that a lot of the kind of feelings that people get if they don't feel quite right are usually a muscular thing, and sometimes they're not. So we need to make sure that we analyze those or if we don't know how to analyze them, then to refer them on to the people that do. So hopefully this will all kind of make sense as we go through. So last week we started to look at the compartments of the thigh, and we were concentrating mainly on the anterior compartment. So we looked at all of the quadricep muscles. So we looked at your vastus muscles, medialis, vastus medialis, intermedius, vastus lateralis, and then your rectus femoris. And if you remember that the rectus femoris was the one that crossed the two joints, so crossed the knee and crossed the hip, whereas all the vastus muscles, they attach onto the femur, so they only act on the knee. So the rectus femoris also acts on the hip because of its attachment points, and because it is biarticular, so it has two joints that it acts on, it's the one that's more likely to get injured, but just because of the kind of stresses at both end of it. And we talked a little bit as well about Lombard's paradox. So if you go into a squat position, the two joint muscles, so the hamstrings around the back, which we'll look at today, and then the rectus femoris over the front. But when you drop down into a squat, the rectus femoris at the top, so the proximal part, will get shorter, and then the one by the knee will get longer because of the knee bend. So actually the muscle doesn't change length. So there's neither a eccentric or concentric contraction taking place. I think it's more of an isometric type of contraction, and it's the same with the hamstrings as well, but obviously the opposite way around. So by the knee, the hamstring muscles will get shorter as you go into a squat, and then around the hip they'll get longer. So again, there's no real change in the length of the muscles, and that's something called Lombard's paradox. So if you've not heard of that before, that's what that is, and we'll have a look at the posterior compartment today, and where the hamstring muscles go from and to. Okay, so hopefully we'll get all of these sorted by the end of the day. So let's just flick onto this. So this is just revisiting that those compartments again. Just pop my arrow up there. So last time we were looking at all this, all the blue stuff here. So we've got your vastus medialis muscle, and remember when we were looking at them, they attach on the back of the femur. So there's that line down the back of the femur called the linea aspera, which means the white line, and loads of muscles attaching onto there, and you'll see even more attaching onto there today. So yeah, your vastus medialis comes right around the back and literally kind of brushes against these muscles in the medial compartment. So your gracilis muscles right on the inside of your thigh. So there's a little dividing septum. So this bit just here. So that's your medial intermuscular septum. So it's a bit of connective tissue that divides the compartments from the front to the back. So we talked a bit more about that last time. So vastus medialis we looked at rectus femoris there, and then this this big muscle here. So this is vastus intermedius, and then we've got another huge muscle, vastus lateralis, all the way around here. So you've got some really, really big, powerful muscles in that anterior compartment. Okay, and we covered all of those last time. So what we're going to have a look at now, we're going to start to look at these medial and the posterior compartments as well. So we're going to have a look at these muscles that adduct the thigh and act on the knee. Some of them act on the knee, some of them act on the hip. So we'll have a bit of a discussion about that, and then the muscles at the back, the posterior compartment, just here. So these are your hamstring muscles. Okay, so we'll have a look at those too. Happy New Year, Julie. Welcome back. So just going to quickly flick through these because we covered these last week. Oh yeah, and then that one as well. Yeah, so the articularis genus muscle. So that was a real cool one. So one that you don't often hear about. And remember, anything that's got genus in the name is to do with the knee. So genicular. What other words are there? Yeah, genu valgum, genu varum, all of those kind of things, or genus, all to do with the knee. So yeah, if you see a word with genu in it, then we know it's pertaining to the knee. So this little muscle sits just above your kneecap and pulls the suprapatellar bursa out of the way, so that as you go into extension, then the kneecap can glide into the groove and it doesn't pinch onto the suprapatellar bursa. So really, really cool little muscle. It's only that literally that is its only job. So it's quite a cool one that most people haven't seen before. Morning, Stevie. Morning. We've got right crew in this morning. Okay, so this is one that we didn't look at last time. This is a muscle called sartorius. Really, really big muscle, and again, this one crosses both the hip and the knee. Okay, so you can see up here the attachments up here. So this is on your AIIS, anterior inferior iliac spine, and then down onto the pes and serine area just around here. And we're going to have a look at that in a bit more detail. This is often called the tailor's muscle. So where tailors used to sit cross-legged and do their work mending shoes and things like that, they had an overdeveloped sartorius muscle, because the sartorius flexes and medially rotates the knee. So having sitting in a cross-legged position all the time will work that muscle basically. So that's why it's called that. That's why it's given that name. So we've got this really big muscle that crosses over the knee here and then attaches down just on the inside of your tibia. And there's a couple of other muscles as well that attach into there. But what we'll do is we'll add those in as we go through. Morning, Beth. God, I haven't seen you on here for a while. How you doing, Beth? Good morning. Good morning. Welcome. Okay, so let's have a look. Just make sure I've covered all those first of all. Yeah, cool. So let's have a look at your. We'll have a look at some of the muscles of the medial compartment, and then I'll add in sartorius because some of the videos show them together because they are really close together. So we talked about the compartments of the leg, so down around the shin, and now we've talked about the compartments around the thighs. We've looked at the anterior compartment. Now we're going to have a look at that medial compartment. So this is the one on the inside of your thigh. And if you remember what I said last week, each compartment pretty much has its own blood supply, its own nerve supply. So the muscles on the inside of the thigh are supplied on the whole by the obturator nerve. Okay, so that, as we get up into the pelvis, then we'll start to talk about those nerves. We'll also next week have a look at the femoral and sciatic nerve as well, so you can see where they travel through and all of the muscles that they innervate in those particular regions. So right then, let's have a look. Rare morning off, good, good. Right then, so this is a huge muscle. Okay, this is one called adductor magnus, and like I said, we'll have a look at it on the videos in a second. It's often called your fifth hamstring. So we've got muscles at the back of the thigh, which are called your hamstring muscles, and there are three of them, but one of them's got two heads. So we've got semimembranosus, semitendinosus, and then biceps femoris. So bicep means two-headed. And then we've also got this muscle as well, which also assists in extension of the hip. And if you have a look at where it attaches, so it's around the knee region, but it doesn't actually affect the knee itself. Okay, so this is more of a hip muscle. Okay, because of where it attaches just here. So this is the adductor tubercle, which we looked at in one of the first sessions. And because it attaches there and doesn't cross the knee, it's going to have no effect on the knee. Okay, so this, because of its attachment up here on the pubis, the only joint it can move is the hip. So the adductor magnus attaches just above the knee. There are some adductors, one adductor that goes below the knee, okay, so, and acts on the knee itself. But the majority of them act on the hip. Okay, so although they're attaching in the knee region and we've included them in the knee, you have to be really careful not to confuse which ones work on the knee and which ones work on the hip. So this is your adductor magnus, and magnus because it's really big. Okay, it's a huge muscle. So let me just show you this one. Hopefully it is geared up. Yeah, here we go. Cool. So these images here. So what I've started to do is overlay some of the images from the trail guide onto the screen now, so you can see them in a bit cleaner. So these are the kind of typical kind of textbook pictures that you will see, and it's like really obvious what everything is. So you'll see on adductor magnus that it's kind of split into two big muscles really, and you've got the posterior compartment, and that is the one that mainly extends the hip, and then the more anterior compartment, which will help with a bit of hip flexion but also adduction of the hip, but all attaching onto the femur as well as the pubis. So let's have a look at this. So we'll just play this through. So there it is in real life. Just pause that. Just get this out of the way so you can see everything. Okay, so you've got the adductor magnus muscle here. Okay, so this has been all dissected away. And then we've got this bit here, which is the tendon coming down onto the adductor tubercle. And you'll notice that it's got this gap here. Okay, and you'll see that in this picture as well. That gap there is really important for later when we start looking at the blood supply down to the leg. So the popliteal artery that we've seen before. So that's called your adductor hiatus, that area there. And I'm just going to move me out of the way there. So you can see that it provides a pathway from the front of the thigh through to the back of the thigh. Okay, you have only got one blood supply, one tube to supply from the hip the whole of the leg. Okay, so the femoral artery, which starts up in the groin area, is the only blood supply you have for the whole leg. So what it does is it travels along the front of the thigh initially. So if we go back here, so the pathway of that femoral artery is along here. So sits on the front. So this is the front of the femur, goes all the way along the front, and then to get to the back to become the popliteal artery, it goes through that adductor hiatus, and then round to the back, pops through there, and then that's when it becomes the popliteal artery. Okay, right around the back there. So you can see the different fibers of the muscle, and you can see why it's called Magnus as well, because it is just huge. Okay, massive, massive muscle. Just pop that there again. So this is back to the front now. Yeah, so really, obviously that's why it's called adductor magnus. Big muscle there. So that was this one. If I just go back there, so that's your fifth hamstring. So again, see how it looks on the pictures, nice and neat. And you're thinking, what's that little gap there for? Well, now you know that's where your blood supply passes through, so that it can get supply the whole of the leg. Then you've got some other muscles that act on the inside of your thigh as well and bring about adduction. So you've got five muscles all together that adduct the thigh. Okay, and the way to remember them is three ducts. So if you imagine three little yellow ducks, or chicks they would be if they're yellow. So three ducks pecking grass. So it's three ducts, which is adductor magnus, brevis, and longus. So those are your three ducts. Pecking, pectineus, and then grass, gracilis. Okay, and so those that's an easy way if you're doing exams for learning anatomy. That's the way to remember which muscles are your adductor muscles. So you've got three ducts pecking grass. So this is one of the ducts. This is adductor longus. So this is one of the long adductor muscles. So magnus is big, longus is long, and then we've also got this one, hopefully. Oh, not that one. Where's it gone? Oh, it's not on there. Set that up perfectly. We've also got brevis, which means short. Okay, so three ducks pecking grass. So we've got adductor magnus, which we've just seen, adductor longus, and then adductor brevis. So I'll show you a little video of those other two. Let's just have a look at those. Here we go. Get rid of that one and that one. Okay, so bit more in depth this one, just going to move me out there. So this is, again, you've seen adductor magnus. Okay, so we've seen that one already. There's your femur, there's your greater trochanter at the top there, and there's your adductor hiatus, which is where the blood supply from the front to the back goes through. So let's just play this video a second, just move that out of the way. Here we go. So that is your short adductor muscle. So that's adductor brevis. So brevis means short, longus means long, magnus means massive. Okay, so there's adductor brevis, and there's adductor magnus sitting right by it. Let me just go back a little bit and pause that there. Okay, so what you can see here is these muscles are more anterior, so they're more towards the front. So you've got brevis just there, and then longus there with magnus tucked behind it. Okay, so hopefully you can work out now why magnus helps with extension. It's because of the position of it, because it's right at the back of the adductors, and those posterior fibers of magnus will help to extend the hip. So let's just pass this through. There we go. So these are the attachments on the pubis. I'll just pause that there. So we've got the brevis attachment just like literally underneath your pubic bone, and then the longest attachment right on the front of the pubic bone. Now, if you have adductor injuries, then it's usually another one of the adductors that where you feel it. It's the pectineus muscle, which we'll have a look at in a second. But usually you'll complain of pubic pain. Okay, so it's pain right on that pubis. The only problem is, and we'll have a look at this when we get up into the hip and the pelvis, there is a ligament that attaches from the pubis up to the ASIS just up here. And in a bloke, there is a little gap in that inguinal ligament. And the gap is there because of the spermatic cord going through to the testes. So because there's a gap in the in that inguinal canal area, that means that blokes are more likely to get inguinal or inguinal hernias. So sometimes it may be a muscle problem, so it might be a muscle strain, but it could also be, and we often call those sportsman's hernias, but it could also be a herniation through the where the spermatic cord goes, and so an inguinal hernia basically. So you have to be really careful with missing these basically, because some people go, oh yeah, I felt something go in my pubic region, and you think, oh, it's just a muscle strain, but it could be a herniation, so they do need to get assessed. So these are the usual pictures that you'll see in the trail guide book. Okay, so you can see longus and brevis there, and then there's the other one that I was talking about just a second ago, so pectineus. So that's another very small adductor muscle which sits just on top of the pubis. So we'll have a look at that in a second. So so those are your attachments here. That's the attachment for adductor magnus, and then here are the attachments for your brevis and longus muscle at the back. I'll just go back there. There we go. Okay, so and that line there, that ridge again, that's your linea aspera. So that's what we were talking about before. So remember, your vastus lateralis attaches into here, vastus medialis attaches into here, your adductor magnus attaches onto there as well. You've got all of these really big muscles, really powerful muscles attaching on that ridge, on that line on the back of the femur. So, and there they are at the front. So that longus attachment there, if I just pause that there, ooh, just missed it. Bear with me a sec, just try and pause that. There we go. Okay, so the bottom of adductor longus, so all the way down here, can you see how it kind of merges with the adductor hiatus there as well? So it forms the roof of the hiatus, so it comes quite low down on the femur. So you're looking at the distal third of the femur is where it ends. Okay, so that's adductor longus and adductor magnus, and then the other one that we are missing is this one, and this is pectineus. So this is your pubis, so that's your pubic bone. There's your greater trochanter. This is your femur down here. You can see the adductor longus and brevis, which we were looking at previously. Let's just play this one. So this is your pectineus. Now this is the one that usually gets injured with a groin strain. So if you have footballers come in complaining of groin problems, then usually it is pectineus that they've injured. Okay, really powerful, very short adductor muscle. Okay, so that's that one there. So attaches on that pubic rami, and rami means a branch, and then just down here, just below your lesser trochanter. Okay, so again, we've got all of those really short muscles attaching all around that part of the femur. So we've got 3 short adductor muscles. So we've got pectineus, we've got adductor longus, and adductor brevis. So they're all really relatively short muscles that are attaching into the femur and up onto the pubis. Then we've got some longer ones, which is adductor magnus, so that goes all the way down to the adductor tubercle. And then another one, which is gracilis. So let's just have a look at that one. And we've got a couple of muscles merged into one here. So we had a look at sartorius right back at the beginning. And we're going to have a look at both sartorius and gracilis together because they insert into the same place. Okay, so this one is your sartorius muscle. So that's one we looked at right at the beginning of today's session. So that's that one there. That's your Taylor's muscle. And just move me out of the way. So that's the image that you normally see in the books. So that's your big sartorius muscle coming across there. There's your VMO, so your vastus medialis, and there is the gracilis muscle. Okay, and the reason why we've got these two together is because they both attach into the Sargent area. Okay, so this bit here, so this bit, there's your tibial tuberosity. So we've looked at that quite a while ago, and then this bit here is your medial tibia. Okay, so there's your tibial condyle, and that bit there is your medial tibia. And we've got this pes anserine or pes anserine area, which means goose's foot. Okay, and there are three muscles that attach into there, and they look like a webbed goose's foot. Okay, as they go in. So that's why it's called the pes anserine. So let me just move me out of the way there a second. Just play this. So we've got three muscles that attach into there. Some people remember this by sergeant, so that's why I've put the military man there, barking you orders. So you the three letters SGT, short for sergeant, or say grace before T. Okay, so you've got sartorius, gracilis, and semitendinosus. So those are the muscles that attach into there. So sartorius, gracilis, and semitendinosus. So sartorius and gracilis are that's sartorius and that's gracilis, and then semitendinosus is one of your hamstrings, so around the back. So we'll have a look at that in a second. So those are your say grace before T or sergeant group, and I think that's it for that video. Yeah, there we go. Okay, so that's sartorius, gracilis, and semitendinosus all attaching into that area there. Just make sure I haven't forgotten anything. Yeah, so there's your gracilis. And now, remember what I was saying before. So adductor magnus attached onto the adductor tubercle. So literally just there. So just above the knee. Your pectineus attaches really high up in the groin. Then you've got brevis, again, which is quite high in the groin. Then you've got longus, which comes down to, well, around about there, so that distal third. So all of those attaching into that region there. So none of them cross the knee. So they only act on the hip. They don't do anything on the knee, but they're obviously attached to the femur. So we're kind of working our way up to there. This one, though, does attach below the knee and above the hip. So it influences both the hip movements. So it will help with adduction, bringing the leg in towards the midline of the body, but it will also act on the knee as well. So if you have a look on what it does, so it flexes and medially rotates the knee. So it will help with knee flexion, so bringing the heel back towards the bum. And when the knee is bent, it will also help with rotation of the tibia. Okay, so it will help rotate your tibia medially. So when we're looking at this works in conjunction with your hamstrings. So the hamstrings and the gracilis muscle, they act, when the knee is bent, they act like reins on a horse. So the medial muscles will be rotating the tibia medially, and the lateral muscles will be rotating it laterally. So it helps to guide the tibia whilst you're running, walking, whatever it is you're doing. So as soon as the knee is bent, then those muscles can help to rotate the tibia to get it in the right place to be able to do what you need to do. Okay. There is a way to differentiate between your short adductor muscles. So if you think about clinical testing, if you only do an adductor test with the leg straight, and then you're pressing or the position that you're testing it is below the knee. So you're trying to pull the legs apart, but you're doing it with your hands below the knee. Then you are going to be testing gracilis as well as all of the other 4 adductor muscles. Okay, so you all of the short adductors and then your adductor magnus as well. But if you have the knee bent, so then you're going to shorten gracilis. So it's going to kind of take it out of action really. And then if you place your hands above the knee and then get somebody to squeeze inwards, then you can't. The mechanical advantage of gracilis is gone, because gracilis acts below the knee, not above it. Yeah. So if you place your hands on the just above the knee, so if you place them just here, and then get the person to squeeze in, you are then focusing on these short adductor muscles. So sometimes people can test strong when you test the adductors with when you're pulling down here below the knee, but when you bend the knee and you test, that's when they get pain, and it's because you're focusing the effort, or they're focusing their effort on the short adductor muscles rather than the long one. Okay, so again, knowing where things attach is important for testing. So yeah, so that's that one. Then we're going to have a look at, just get the right PowerPoint. There we go. So now we're going to have a look at the hamstrings. So we've had a look at the anterior compartment. So all of the muscles that flex the knee. Had a look at the medial compartment. So we've had a look at all of your adductor muscles, as well as the short and the long ones. So 3 ducts pecking grass: adductor magnus, brevis longus, pectineus, gracilis. Now we're going to have a look at the posterior compartment, so your hamstring group, so your hamstring muscles. So these are where they attach medially. Okay, so this is obviously a view from the front. This is your patella. There's your adductor tubercle just there, and then here's your pes anserine area just here. And then we've also got these attachments posteriorly. So we've got this one here, the posterior medial tibial condyle, which we've looked at right back in session 1, and then there the fibular head. Okay, so the green dots are your hamstring muscle. So if we go back here, so we've got a hamstring muscle attaching here, the pes anserine area, and if you remember, that was your Sargent group. So say Grace before T, sartorius, gracilis, and semitendinosus. So that's the green semitendinosus area. Okay, and then on the back of the leg, we've got another medial hamstring, and we've also got a lateral hamstring. So the one that attaches here is called semimembranosus, and then the one that attaches here is called biceps femoris. Okay, so we've got semitendinosus, semimembranosus, and biceps femoris. Those are all of your hamstring muscles. If you've not heard of them before, that's what they are. So this is one of those grids that you can use for revision. So if you want to pause it, take a snapshot so that you can reuse this again and again. So we've got your semimembranosus muscle, which is from your ischial tuberosity, so your sit bones, onto that posterior medial tibial condyle. So that's where we've just had a look at. We'll look at the videos for these in a second. Then you've got semitendinosus, which again attaches on your bum bones, so on your ischial tuberosity, and that goes to the proximal medial tibia, so the pes anserine area. So that's your Sargent group, sartorius, gracilis, semitendinosus. Okay. Then we've got biceps femoris. Now, biceps femoris attaches in 2 places because it's got 2 heads. So biceps means 2 heads, and femoris obviously femur. So we've got a long head which attaches on your bum bones again, so ischial tuberosity, and then the short head is on this linea aspera again. Okay, so we've got another really big muscle that attaches on that ridge on the back of your femur. Okay, and then that attaches onto the head of the fibula. So we've just had a look at those a second ago. So let's have a look at those. Just pop the videos up of that one. So we want this one. Cool. Okay, so this is a view of the back of the knee. So there's the posterior capsule just there. These are your medial hamstring muscles because there's two of them. So we can see two tendons there. And this is a really good picture actually, because where people usually injure their hamstring is this bit here. Okay, so that is where the tendon starts to turn into a muscle. And we call that, and if you read it on MRI reports, it's called the MTJ. So it's the musculotendinous junction. So the fibers are changing from muscle fibers into tendon fibers. And the tendon fibers are a bit more elastic than the muscle fibers are. So if a lot of force goes through that area, and the capacity for the muscle just isn't there, then that is usually where you're going to get the injuries. So there's lots of different ways that the muscle can feel sore. It can be because of injury, or it can be because of a fatigue-induced soreness. So there is something called the Munich consensus, and that's something to have a look at. If the whole muscle belly feels sore, and it's all the way along the whole of your hamstrings, it basically means that you probably did a bit too much. So the capacity of the muscle didn't match what you've asked it to do. So, for example, especially now, you've got people who are going, right, I'm going to get my running shoes on again, and I'm going to get out running because I need to get fit because it's the new year. So they go out for a 5K run, and they and actually 5Ks is quite far for someone who's not done something for a while. So their muscles get really sore. And they come into you and they go, oh my God, I think I've injured myself. But it's the whole of the muscle feels achy and sore. That is a fatigue-induced soreness. Okay, so it's a bit different. So if you have an injury, it's usually in these specific areas. So when you poke and prod the rest of the muscle, it feels okay. But when you get to this bit, there is a specific point that is really tender. And sometimes there's a bit of a gap in the muscle, and usually there's a bit of bruising, and they've also had a bit of a tear. And they've heard it or felt it. So if they're going, yeah, I felt okay when I was running, but then the day after, bloomin' heck, it was really sore. That is usually a fatigue-induced soreness rather than an injury. Okay, an injury would be I felt it go and I had to stop. Yeah, so and that's one of the big differentiators between being injured and having a fatigue soreness. So yeah, usually around this area here. If it is around here where the tendon inserts onto the bone, that's called the OTJ. So that's the osseous tendinous junction. So where the bone attaches to the tendon. If that ruptures there, that is usually a full rupture. Okay, so if there's enough force for that to go, for example, for want of a better word, then the whole muscle will have detached. Okay, it usually doesn't happen around here by the knee for the hamstrings. It usually happens on the ischial tuberosity. I had a patient of mine. This happened to her back in September last year. She was walking along in a shopping mall, didn't notice that there was a wet floor, slipped on it, so a heel stepped on it and slipped, and basically did the splits. And she said, I've got this real pain in my hamstring, but there was no bruising at the time of it. And then I said, well, you need to go to A&E to get it scanned because I think you might have ruptured it, from what she said, because she said she felt it rip. And then literally the next day she was just black and blue. Okay, so sometimes with those kind of injuries, it doesn't come out straight away, it comes out a little bit after. But it was absolutely black and blue down the back of her leg, and that was a full OTJ, so an osseous tendinous junction rupture at the ischial tuberosity. So it just basically detached from its insertion point. So just to give you a bit of an idea about when things are injured, where they're usually injured. So 3 muscles at the back, but with 4 heads. Okay, so that's why the adductor magnus is considered the 5th hamstring. So we've got semimembranosus, so this one just here, which means half membrane. So it's really flat and quite broad. And then we've got semitendinosus, which is half tendon. So that has got a really, really long tendon. And the way to remember these is tendinosis is on top. So you can feel tendinosis. So if you have a feel on the inside of your knee, around the back where your hamstrings are, drag your heel along the floor, but without it moving. So an isometric contraction, and you will feel a big tendon on that inside of your knee, on the back of your thigh. That is your semitendinosus tendon. And then just underneath that, sometimes you can get your fingers underneath it, you'll be able to feel membranosus as well. So membranosus is a bit flat. Neil has said, is that the same? I'll just get your comment up there. Is that the same as an avulsion fracture? Yep, that's exactly it. So where the tendon has come away from the bone, that's called an avulsion. Yeah, good, brilliant. So semimembranosus, semitendinosus. So tendinosis is on top. That's the one that you can feel really prominently on the inside of your leg. So you can see just on the left there, I've shown you. I'll just pause that there. There's loads going on this one. I'll just slow that down a bit. Okay, so yeah, pictures on the left here just to show you from the Trail Guide book. And then here is the attachment for semimembranosus. So it's on the posterior medial, so on the back and on the inside of your tibia. So there's your fibula there, which is on the outside. So that's your posterior medial tibia. Okay, so that's where membranosus attaches. I'll just play that there we go. So membranosus on the posterior medial tibial condyle, and then just play that a little bit more, and then tendinosus, if I just move me out there. So this again is part of your Sargent group. So we had sartorius, gracilis, and now this muscle, so semitendinosus, this is on the pes-anserine or pes-anserine. Tendinosus is on the pes-anserine, pes-anserine, and that's your Sargent group. So sartorius, gracilis, semitendinosus. Pop me there we go. And then on the lateral aspect, so this is down the outside, so you can see the IT band just here. That long tendon there is your biceps femoris tendon. And to be fair, out of all of them, the biceps femoris is usually the one that gets injured. So there's your biceps. Okay, so biceps means 2 heads, and then femoris means femur. All of your hamstrings attach up here on the ischial tuberosities, and or they start from here, apart from this one just down here. So the long head of your biceps femoris will attach up here, but the short head starts down here. Okay, so if you have a look at here, so there's your long head of biceps, and then that's the short head just there. Okay, so we've got 2 heads on this lateral hamstring. Just move me out of the way there. So there's your linea aspera, and then it attaches all the way down onto the fibula head, which is just there. And if you remember what I was saying before, your hamstring muscles, just get rid of that. So your hamstring muscles, pop up back in, there we go. So hammies, semitendinosus, semimembranosus, which are medial. Okay, so they're attaching on that medial part of the tibia. So when your knee is bent, it can rotate the tibia medially. Okay, and on the other side, and the gracilis as well. So the gracilis is around there as well. So that can help to medially rotate your tibia when the knee is bent. When the knee is straight, because the ligaments lock the knee out, you don't get any rotation from the knee. Okay, so at that point, you'll get hip medial rotation because the knee is locked out. Hopefully that makes sense. So when you bend the knee, you can rotate the tibia, but when the knee is straight, because the ligaments all tighten up, so anterior posterior cruciate and then your medial lateral collateral, when they're all locked because of that extended position, you will get rotation, but it will come from the hip. It won't come from the knee. Okay. When the knee is bent, on the lateral aspect, you've got biceps femoris attaching onto the fibula, so that will rotate your tibia laterally. So they're like reins on a horse, pulling inside, outside to guide your tibia as you're moving. Okay, so a lot of muscles there. Done them all though. I wanted to get them all done so we can concentrate on the nerves and blood supply next week. If anybody's got any questions about anything today, want me to go over anything or clarify anything, pop a message in the group over the week and I'll add those in next week. No problem at all. Otherwise, have a good week and I will see you next time, and we'll be looking at the blood supply and nerve supply for the thigh. I'll see you then.